Yes, Dr. Foster. Please come in. So Dr. Foster, as the Chief Operating Officer, it is your job to find our company an EHR system. I'm getting heat from the Executive Board about the progress of our search. Can you provide me with an update regarding your progress?
Bill, as the CEO of our company, you should have enough confidence in me to let me do my job. I have a great team that is presenting the Allscripts EHR system this week. Maybe you should check your calendar. I sent you an invite over a week ago. Sorry, I have to take this call. It's from the HIT committee. We plan to meet tonight to work on some last details of the presentation. Look forward to seeing you later this week.
Dr. Foster, I don't appreciate your tone. I'm under enormous pressure to ensure we have our EHR up and running according to our strategic plan, and you act like it's no big deal.
Bill, never fear. Wait until you meet the Fantastic Four and see their presentation on Allscripts. Trust me, you won't be disappointed.
Dr. Foster, thank you for joining us today. Word on the street is your boss thinks you're not taking the EHR project seriously. Do you have a response for our viewers?
Well, Alan, Bill may have his doubts, but this is not my first rodeo. I have all the confidence in the world in my HIT team.
Hi Crystal, I just spoke to Dr. Foster. She told me that Bill doesn't believe we can pull this off. I'm getting worried. Let's get over to our meeting with Sarah and Scott.
While I'm a little shocked to hear that, I think we stay positive and remember, we got this.
Okay, so maybe not superheroes, but definitely the Fantastic Four.
Hi, I'm Scott West, HIT Committee Chair, and this is the rest of my team, Melinda Matthews, Crystal Cowan, and Sarah Serrano.
We've been charged by our senior management team to evaluate the Allscripts EHR platform for our agency. We're attempting to transition to a 100% paperless system by 2017. We plan to provide a high-level description of the product suites for the acute and ambulatory care settings, and an in-depth review of the post-acute care Allscripts HomeCare suite. Let's get into the boardroom to see how things are going. I believe Crystal is beginning her presentation.
Welcome everyone to our Allscripts presentation. Dr. Foster's team has worked long and hard to research this product for us. Due to time constraints, plan to stay well after the presentation, as I'd like to hear from you and submit a cost analysis and recommendation to the board by tomorrow morning.
Good morning everyone. Every good story has a beginning. I'd like to start by sharing with you the evolution of Allscripts. Please draw your attention to the screen. Allscripts is an industry giant and leader, with their products spanning the healthcare continuum. For 3 decades Allscripts has worked to be the provider of choice. Since its conception in 1986, they have pushed their way into the market through a series of acquisitions and mergers. From Messies in 2008, Eclipses in 2010 and DB Motion in 2013, from e-prescribing, to emergency medicine, discharge care management, population health, value-based solutions. Allscripts is there. A new partnership with Hospital IQ will allow the integration of a genomic solution and predictive analytics platform that will be available through select Allscripts products.
Allscripts features a developer program in which they are able to sponsor software developers and thereby more quickly implement products and outcomes. To further explain this concept, we have included a video clip on Chart Scout by Emerge, an Allscripts certified rising star. Action.
By having a presence in so many markets, Allscripts is able to advertise an integrated platform of solution, a single continuous patient record. Allscripts offers the Sunrise Suite for hospitals and major health systems. Starting with Sunrise Enterprise Registration and Care in Motion for discharge planning. Also, Sunrise Enterprise Scheduler, Financial Manager and a mobile MD2 application using M-Modals, voice-to-text feature. And lastly, Sunrise Surgical Care. Now, at this time, I'd like to bring back Melinda Matthews.
Allscripts serves the outpatient setting with professional EHR for small to medium practices and TouchWorks CHR for large clinics, academic centers or multispecialty practices. Contributing to our seamless one-patient record is Allscripts Review Cycle Management, Care in Motion, the Allscripts Wand and Remote Access Tool. The Allscripts Practice Management Platform provides the practitioner with scheduling tools and reminders along with eScript capability and NoteSwift for dictation.
Lastly, Allscripts provides the post-acute care setting with their HomeCare suite. Allscripts offers other products to complement its core product, such as document imaging, interfaces for telehouse, HL7 connectivity, mobile devices, and a physician portal.
In April of 2016, Allscripts announced their joint venture with NetSmart. NetSmart is known to be the largest human service and post-acute care technology provider in healthcare. This merger could not have happened at a better time. With CMS's shift of focus to the post-acute care setting, this could be just what Allscripts HomeCare needs. At this point we would like to narrow our focus and presentation to the post-acute care setting, with an emphasis on hospice care, whether a freestanding residence, long-term care facility, group home, etc. In home care and hospice, we provide care for the patient wherever they call home, but, the question still remains, will this system meet the needs of our agency and unique needs of our sector of the healthcare industry? Let's see. Allscripts HomeCare was designed for any size enterprise, from a small 5-user agency to a multi-location business with hundreds of users. A familiar Windows-style graphical interface allows the user to point, click and drag, making it easy to use and saves keystrokes. So, we have a familiar Windows interface from which to work. The system supports most common Windows-based laptops. Field devices can be remotely synchronized with the home office system, keeping everyone in the loop regardless of location. Security, a hot topic. Access to data, functions, screens, and records is password protected and set by the system administrator. We decide what access each user will have. At this point, I'll hand off the presentation to Crystal to discuss other key functions of Allscripts.
We were so excited when recruited to this project. As Health Information Manager, I cannot wait to have the ability to convert to a paperless system. The next portion of the presentation includes some screenshots from the actual program for you to view. Scanning and elimination of the paper-based medical record is made possible through AllDocs. And while we would love to be completely paperless, we know there are times when it's appropriate. For example, if power were out and we revert to a downtime protocol. Or to scan in insurance information, advanced directives, etc. Regulations require the hospice and long-term care facility charts mirror one another. This can be more easily accomplished by way of scanning their forms directly into our EMR.
Mobile Light is a portable point-of-care device that we plan to have our hospice aides use while in the field. The interface is fully intuitive and works on a Windows 7-based smartphone, while offering a lower cost of ownership option. It has several features customized for home care, such as time and attendance functionality, location collection, mileage calculations and a GPS feature. And of course, clinical data entry with a synchronization option. At the completion of a visit, the hospice aide will need to obtain a signature from the patient, caregiver or facility staff member, signifying receipt of care. You heard us reference the term synchronization. Staff can remotely synchronize devices with the home office system. Synchronization uploads field data to the home office and automatically updates the data in field devices based on changes since their last sync. This should be done daily.
Being effective in your role requires excellent organizational skills. Allscripts features a scheduling system with built-in reminders for meetings and even licensure renewals. Allscripts uses a knowledge-based medication tracking system, improving communication between clinicians, thereby reducing medication administration errors and enhanced coordination of care. Allscripts accomplishes this by using a shared EHR platform, along with unified clinical rules and data views across the entire system. Allscripts HomeCare does not currently interface with medication dispensing devices, creating additional labor for pharmacy staff and increasing potential for medication errors.
Our hospice has an internal pharmacy that provides medication to the inpatient facility and those patients who reside in a home setting. Due to regulatory requirements, long-term care facilities must designate a preferred pharmacy. Given the sheer volume of facilities that we work with, we must employ the use of a Pharmacy Benefit Manager or PBM, to ensure accurate billing. At present, Allscripts has one PBM interface that is only compatible with Optum, formerly known as Hospice Pharmacia. The payer path system is amazing. We beta tested the program and brought our days in accounts receivable from 45 down to 36. This is below industry standards.
Claims are created and submitted for review prior to official submission for payment. A response is sent back with suggestions for correction or a thumbs up for submission.
The system has an ad hoc reporting feature that is very helpful. One is able to export data in pivot tables to Excel by selecting criteria you want to review. For those not comfortable with Excel, this may present a problem. Custom queries can be created, or one can use pre-populated reports such as productivity and sync reports. Government mandates and quality reporting requirements are evolving rapidly, meaning that we are being asked to do more compliance work than ever before. Allscripts is committed to making sure all of these increasingly complex quality reporting requirements are met by incorporating solutions into the program.
While we have a competent IT team, there may be times when a problem is outside of our scope of expertise. Allscripts provides comprehensive tech support to its customers 24/7, 365 days per year.
It is my responsibility to ensure that staff receive proper training on the Allscripts system. Please see a clip from a recent meeting with our Allscripts representative.
The importance of e-learning is more essential in healthcare than in other businesses. The rate of change in the medical field and continuing education requirements for clinical and administrative staff make just-in-time learning a necessity for the home care industry. That's why we have created the Academy for Allscripts home care users.
Jeremy, can you provide our viewers an example from the Allscripts Academy site?
This is an example of our mobile light training module. The learner would start by signing in and selecting the course. You then select your designated role. The user will have a series of selections to choose from. I'd like to go into the introduction section. We do this by merely clicking the link. And now the video camera icon.
As a new home health or hospice aide at the agency, you'll be provided with the resources you need to do your job. Allscripts Mobile Home Care Lite will be one of those tools. This easy-to-use application can help you manage your workday. Each day, when you log into Mobile Home Care and begin the day, your schedule appears. You can see all of the patients scheduled for that day. All of the information you'll need is accessible from this screen, including how to get to the patient's home using the built-in turn-by-turn map directions. As you travel from visit to visit, recording your start and finish times, your mileage is calculated based on a built-in GPS functionality. This will make it easier for your agency to keep track of your mileage. You'll find care plan charting for each of the patients you see and the tasks that must be completed, including any vitals that may need to be taken. Once you have fully documented your visit, it's submitted back to your agency. With Allscripts Mobile Home Care Lite, you'll have the information you need to perform your job and manage your schedule.
After some convincing negotiation, we were able to come up with the following offer to share with you today.
We project implementation costs to come in at around $358,000. And annual upkeep costs of $154,000. Thereafter, we have included a breakdown of these costs which will also be emailed to you after the presentation.
Allscripts touts a seamless, one-patient record. However, please be aware this is only possible when everyone in the care continuum is on the same platform. In researching this issue, Allscripts indicated they may be able to work with an organization to create an interface that will work with a non-Allscripts platform. However, this comes at the bargain price of $15,000. And it does not guarantee that the interface will work.
Our two major hospital systems recently transitioned to using the Epic electronic health record. Be aware that Allscripts is not compatible with any of the referenced software. Pros and cons of the program are listed for your review. We have been asked to not sell the system. So, I will only objectively interject that I feel the program could meet the needs of our agency. While there are some limitations, overall the product is sound for a home health or hospice provider. I would like to conclude with some updates from NetSmart. If you recall, we mentioned them earlier in the presentation. They advertise an integrated care fabric platform. A recent publication in Forbes magazine reveals that consumers can look forward to enhancements to the Allscripts NetSmart product. This is encouraging news for the home care market.
I'm a bit surprised to hear how much this will cost to implement, and am concerned given that we are a non-profit organization. Let's take a closer look at the financial analysis.
Dr. Foster, I need your help.